Welcome to our Global Wellness Day, 12 Hours of Transformation Online Celebrations, presented by Chiva-Som and Zulal Wellness Resort by Chiva-Som. And again, nice seeing some of our guests who participated in our previous sessions. This seminar is entitled Hijama Therapy, Fertility, Pain Relief, Chronic Fatigue, and Digestive Problems. I am Kelrin Sukhumjitanon, Head of Communications at Chiva-Som, and I am your host today. This session will be led by Dr. Purnima Siddhanta. She is a holistic manager at Zulal Wellness Resort. And today, she will discuss Hijama therapy, fertility, pain relief, chronic fatigue, and digestive problems. With 17 years of extensive experience as an Ayurvedic professional and a specialist, Dr. Purnima has held key positions at some of the world's leading hospitals and wellness institutes. Her significant experience has garnered her some major attributes, particularly when it comes to working with chronic illnesses. She holds an MD degree in alternative medicine, along with expertise as a counseling practitioner. She is passionate about introducing the concept of wellness practices into her guests' daily lives and help them reach their optimum health goal. Now it's time to meet Dr. Purnima. Hello, Dr. Purnima.
Hello. Thank you, Kevin. Welcome, everyone, and greetings from Zulal by Chiva-Som. I am Dr. Purnima Siddhanta. I am the Wellness Manager at Zulal Wellness Resort, and today we will be talking about Hijama. We will talk about what Hijama is, what is the history related to Hijama, what are the types of Hijama, and as we already said that we will be discussing the benefits and applications of Hijama with respect to fertility, pain relief, fatigue syndrome, and also any other applications of this particular treatment that we have, I will be discussing all. Talking about Hijama. Hijama is the cupping therapy, which is the ancient form of alternative therapy in which a negative pressure is created by creating vacuum on the skin by putting special cups. The word Hijama comes from Arabic root word al-hajm, which means to reduce or diminish in volume. Basically, this is attributed to the blood, and reducing the blood volume is what we're talking about by applying either suction cup or by other processes. With this, we refer that when a blood volume is diminished or a vacuum suction is applied, the skin draws up into the cup and it creates negative pressure on the skin. The skin swells up inside the skin, and thereby it increases the blood flow to the underlying tissue. Which means by this therapy, we are giving fresh blood to the organ which was either infiltrated with some pathogens or some inflammation, or it had some pain. So this is what is meant by Hijama, and this is what we will be discussing today. Talking about the Hijama's history, this is a very old alternative form of medicine. The earliest historical evidence of use of Hijama is from Egyptian medical textbooks, which is around 1550 BC, or you can say around 3500 plus years of time that it was practiced, which described bleeding used to remove pathogens from the body. This therapy is, when we talk about 1550 BC, we also understand that this therapy, when it was practiced in here, in Arab countries, it was also developing in China as cupping therapy, and in India with Ayurveda's application of horns with to create vacuum to treat diseases and to treat some kind of tumors that it was using it for. So this therapy came it was originated maybe in Egypt or in some other countries, but this knowledge was first recorded in Egypt. And from Egypt, it went to Greeks and Romans, and from Greco-Roman medicine, it went to Arabs. So it was that process where Arabs kept that knowledge, and in this part of the world, it is still practiced, it is still believed. Talking about the belief, many religious text of that era has also mentioned hijama, and it is said that with other things like covering the head, using of miswak, hijama was also one of the therapies, one of the processes that was followed by prophets to detoxify their bodies in their regular lives. It is also said that hijama is attributed to some specific days, to some specific months, and it should be done in specific time of the day. But what I will talk about today is medical hijama, hijama related to wellness, which works on detoxification and relaxation and increasing the circulation of blood in the body. So beliefs and non-beliefs, people who believe in hijama, people who don't believe in hijama, I will keep it to their personal choice, and I will talk about what is this therapy and what is it applied to. Moral theory is the base of hijama's physiology. So we know that Greco-Roman or Greco-Arab medicine or traditional Arabic Islamic medicine, it talks about humors. The whole universe is based on four things, and that is hot, wet, dry, and cold, which means hot and cold temperaments, dry and wet temperaments, everything, whether it is food, whether it is herbs, whether it is environment, whether it is the air, everything is attributed to these four things. And it is the four humors of the body which create the body. So in temperament of these humors, which means the change of temperaments, change of temperature of humors, which are four cardinal humors, yellow bile, black bile, blood, and flame, when there is in temperament or change in temperament of these humors, that is when the diseases come. So what is the base of hijama theory is that we need to create a balance and equilibrium between all these in all these fluids, all these humors. To create the humor equilibrium, we need to either move the blood which is inside that organ, whether it's stagnated or it is not supplying proper nutrients. We need to move that from that organ and provide fresh gush of blood to that organ so that it can heal. In turn, the removal of blood from the underlying organ by applying the vacuum pressure creates a autohemolysis in the body and thereby providing the healing effect of the same organ. So this is what is the basic theory of doing hijama. That is, we create a suction, we create the vacuum pressure to clean, to start the inflammatory process so that the blood which was supplying to the underlying organ gets fresh and the blockage of energy is taken care of. So this is the basic philosophy. And when we come to hijama's applications, it is applied to either pains, it is applied to many therapies, many places where there is stagnation of energy, where we see swellings are there, hijama is applied. But was it always like this? No, because hijama was in Hippocrates, when he was practicing hijama, he was practicing it at topographical level, which means he was using hijama for particular places, for particular illnesses. But when it came to Avicenna, to Ibn Sina, when he was writing this book called Kanun fi al-Tib, which means the canon of medicine, it is described in this medicine book that it is always good to use hijama for clarifying the humors, for improving the flow of blood, and for relaxing the muscles. So this is the basics of hijama theory. And when talking about which category does it belongs to, in Greco-Arab medicine, in Greco-Roman medicine, it is said that when there is inequilibrium between the humors, there are various modes of treatments that has to be applied. One of them is ilaj bil tatbir, which means regimental therapy. Other one is ilaj bil gaza, which means dietotherapy. Ilaj bil dawa, which means pharmacotherapy. And ilaj bil yad, when all three of them don't work, then we have to perform a surgery. This is the common mode of surgery. So hijama therapy comes under regimental therapy. Hijama comes under Ilaj bil Tadbir, which has two words in it. And one is Ilaj, which means treatment, and other one is Tadbir, which means regime. Al-Razis or Razi, Ibn Razi has defined that cupping is a regimental procedure in which morbid matter is evacuated from the superficial blood vessels located in the fascia and muscles. And here we can see that their morbid matter is meant by the humors, which is stagnated there, and it is evacuated, which is due to the pressure which was created by a cup. The blood vessels start giving in fresh blood, and the stagnation was pulled up. Thus, the blood circulation is maintained. What are the types of hijama that are we talking about? Hijama is of two types: hijama with scarification, hijama without scarification. In case of scarification, hijama is done when we need evacuation of humors, when the blood is let out. That can be done because of any prophylactic uses or any therapeutic purposes. We need to drain some abscess, or we need to cure some kind of inflammatory process inside. Then this blood is let out by applying suction. The hijama without scarification is done basically to dissipate the humors from the internal organs to the surface of the skin, which is basically increasing the circulation and starting the rejuvenation process of the tissue. How it can be done? It can be done either by applying manual suction pump, where we can create and control the suction and pressure of that cup, or it can be done by fire cupping. In Ibn Sina, in his book Kitab Fi al-Tib, he says that fire cupping is always better than doing manual suction, because it creates the thinness in the humors and it creates them to move forward, and so that it is very easy for the morbid material to come up, and because of the heat, it is easily detoxified. But in regular practice, we do hijama. What I will be talking about today is hijama with suction or with manual suction. So today's point of concentration will be hijama by manual suction, where it can be applied. And at Zulal, when we are doing these treatments, what all can be addressed? So that is what I will be talking about now. So as I said, hijama can be done in many cases. If you see this picture, it has various points reflecting in it. So there are points for heart reflex, there are points for heart, there are points for glands, points for stomach, kidney, and many points are named. So hijama can be done in case of nerve pain, where people have pain and they have no active reason, where people who are on gabapentines, where we divert the pain, causative of pain, and we don't know how this pain is coming. So especially headaches, shoulder aches, and lumbar aches, which is due to suppression of nerve, that is where hijama is a successful therapy. Frozen shoulder, in my experience, I have seen doing hijama with acupuncture in case of frozen shoulders is a remedy that really works very well. So in case of frozen shoulder, hijama can be applied. Sciatica, when the pain is on the back and it goes down to the calf region, here hijama is very successful. People who don't sleep, their sleep is disturbed, maybe due to stress, or they have some trauma, or they are thinking in their nature. So they are always thinking. People who are active all the time, insomnia is the case with which they suffer from. Hijama is a very good therapy in those cases also. Asthma. In case of asthma, I have seen bronchial asthma and asthma due to congestion of lung circulation, which is caused by any allergies or any pathogens. Hijama is a very good therapy in that. Gynecological disorders, either it is dysmenorrhea, if it is stagnation of menstrual fluid, if it is infertility, not all cases of infertility, but specific cases of infertility that I will discuss in further slides, hijama is a very good therapy. Hypertension, it is specifically, this therapy is recommended in this case because we in traditional Arabic Islamic medicine, we believe that hypertension is because the engorgement of blood in blood vessels, which causes excessive heat in the vessels. So it is very good therapy to perform there to reduce the blood volume, to diminish the volume, and improve the heat. Fibromyalgia is, it can be due to coldness of the humors, which again, when done with this therapy, works in circulation, and it improves the circulation between the muscles. And as it has effect in nerves also, it works very well in fibromyalgia also. Chronic fatigue syndrome, people who feel people who feel fatigued all the time, it can be due to excessive phlegm in the blood, or it can be because of the coldness. So both of these can be addressed, but in this case, fire cupping associated with pressure cupping is done. So it is very good therapy to be experienced. Sports injuries, I am very proud to say that many Olympians, I will not take the names, but many Olympians before their performance and after their performance, and they are the winner of gold medals in consecutively 3 Olympics. There are people, these sportsmen, they perform hijama to make their muscles better, their performance better, and improve their injuries. So sports injuries is something that we can say that this therapy works very well on this. As per the text, what are the indications of hijama? If you see this picture here, as per text, we can do neuralgia, we can work on neck pains. Unfortunately, if there is some pain in the removal of some proximity is required, and the pain is still persisting after that, especially with diabetic stumps, when diabetic foot requires removal of the gangrene, requires removal of that of the foot, then there is persistent pain in that stump. This is where dry hijama, which is the pressure vacuum hijama, is very, very successful. It also works on the blood circulation of the gluteal muscles, and establishes a free flow of lymphatics also. So in internal disorders, which is due to either heat or poor circulation, or some toxins are built up, which is due to morbid materials, which is if the humor is stagnant for a long time in an organ, then this therapy can be done. Sihr or black magic, I will not go on these because what I'm talking about today is wellness hijama, medical hijama. So this is a scientific era, so we will have to take that off. Poisons, any kind of poisons which are on the skin due to heavy metal or due to effect of environment, this therapy works very well in improving the blood circulation of that organ and removing topographically the toxins which were accumulated there. So we can see that there are many indications and applications of hijama where it can be worked, and because of its effect, it's non-invasive. The cups can be moved. It doesn't mean that when the vacuum is created, the cup is stationary. We can move the cup, but it is said in the textbooks that when cups movement is done around the shoulder area, it shouldn't be moved up first, because that will increase the pressure around the cranium and the cerebrospinal fluid. So it is always from the shoulder, it should be moved down. So there is a path that should be followed, and this is done by a very experienced specialist. So this therapies, these experiences should be done with experienced practitioners, and that is what we always recommend. How does a practitioner know that what should be his next course of action? How do we know that this is hijama, the process that we are doing is working, or how much we should proceed? It is the color of the skin that tells us that the after effect of the hijama, and also tells the practitioner what should be the next practice. And When it is a healthy circulation, the skin color will be pinkish. In case of moderate stagnation, the skin color will be reddish. In case of severe stagnation, I have seen purple color, and it's dark colored skin color. Uh, in case of congestions, we will see blots, we will see dark and red mixed color, and there will be ecchymosis. There will be spots seen on the, because of the pores, the toxins will try to come out of the pores. So we will see spotty area. And we, in case of deficiency of humor, if there is a deficiency of blood, or if there is deficiency of energy or taka or chi in that particular organ, when first set of cup is applied, if that organ is pale, it is best not to do the therapy further, because then we need to do some other interventions. Maybe hot oil massage is required, or emesis or purgation, which is the other form of cleansing, they are required before we do cupping. So we have, the practitioner checks the skin, the color of the skin is his guide, and also when the practitioner checks the pulse, the volume of the humors in the pulse and his assessment is what guides him for the further actions. What are the sites of hijama which are described in books, in texts? And these are specific points which are done, but it is not limited to, because it is always at the discretion of the specialist what he wants to achieve and what the goal of the guest is. But these are these described sites of hijama for specific reasons. Forehead hijama, hijama done on forehead, usually people don't like to do it because of this scarification, because there will be spot on the forehead. But this is a very good hijama done for headaches, the improvement of the circadian rhythm, which is your sleep, and improvement of circulation in temporal regions of the head. So this forehead hijama is it's obtained, it's done to obtain the results of pain relief, decongestion, and also to it is said that for rejuvenation also this is recommended. Nape of neck is the area where the muscles are taken care of with hijama, and it also works on vertigo, or when there are tremors in head. The nerves are weak, the muscles go weak, and there are slight tremors can be seen in this area. There, the nape of the neck hijama is done, and it is proven to be very effective. But we have to work with a very experienced practitioner in this, because as I already said, the movement of cups is important. How the cups are moved and where they are placed, because this is a very soft organ, and it the cervical spines are very, they supply many nerves, so this needs expertise. Between the shoulder blades is a hijama for clarification of the humors, hijama for pain relief, and rejuvenation of the body also is recommended. These points are recommended. Over the posterior two neck veins is same. These are the points where the strength of head, strength of memory is done, and also in case of poor blood circulation in the cranium, and long-standing pain in cervical region. Over the loins, this works with the organ stress. If there is morbid humors in the internal organs, they need to be removed. That is where the pressure, vacuum pressure over the loins works on. Urinary incontinence or health of urinary system, that is where the loins come in. In front of thigh, it's very good for cellulite and also improvement of all the nerves which are supplying the muscles, which is vastus lateralis, medialis, and internalis. So all three muscles, their supplies is taken care of in this. Gluteus muscle for sciatica, for pains, for good posture. Gluteus muscles are the pressure, the cupping is done, the hijama is done here. Popliteal space. This is a very soft space, and this space is recommended for cleansing of the whole body's blood vessels. And this place also works on skin cleansing, cleaning also. So the morbid humors which are all over the body causing eczema or any color of any kind of skin disease, popliteal space is taken as the point of vacuum pressure. But this is a very soft space and it's just behind the knees, so it needs to be done by a specialist. This is a common ailment for I think people above 40. Back pain, the hijama is done above the bone and between the above the sacrum and the between the ischial tuberosities. So this two fingers around the away from the spine are the spots that are chosen. We can choose 3, 4, 5 spots here. The cups has to be we don't put big cups here. Small cups or medium cups are placed. This place in case of back pain also, and if there is male infertility, these nerves are supplying to the internal organs. So here the hijama is very good for that reason. In case of menstrual irregularities, it is the area of pain and cramps also. So hijama works very well here also. And if there is excess heat in internal organs, hijama done on back related to back pain areas works very well. This pain is shoulder pain, where it is most commonly seen in people where they are active in lifting weights, golfers, bowlers, and swimmers. This point, which is highlighted here with the circle, hijama cupping done on this point relieves shoulder pain specific to this area, where it restricts the range of motion. If there is blood stasis, if there is stagnation of humor in this area due to some inflammation, and if there is sports injury, then we can do hijama on this, and it has proven very good. And as I already mentioned before, there are people who are related to these sports. They do hijama regularly for their upkeep of the joint and maintaining the nice blood flow in here. Digestive system, this is the system where how we know in traditional Arabic Islamic medicine and all, Ibn Sina's book, it's written that stomach is the basin of diseases. If stomach circulation is stagnated, which can be due to stress, people store stress in their kidneys, people store stress in their spleen and liver, people are very angry, and that anger is stored in liver. So if hijama is done, which is very mild in nature on these organs, if you can see in this picture, there are points around the navel, and there are points on liver, there are points on diaphragm, and there are points on the junction of loin. So these points relate to the upkeep of digestive system. So in case to establish healthy circulation between the visceral areas, between the organs, this hijama can be done on these systems. Here, the cups can be moved also in a circular motion, or along with rectus abdominis, around with the muscle which is around the umbilicus. So this can be done. In case of moderate stagnation, if we see in the pulse that there is stagnation of blood in these organs, then the pressure cups can be applied here. In case of severe stagnation, where we see that due to any alcoholism or due to any overeating, high cholesterol, or any other reason, there is severe stagnation and there is phlegmatic humor sitting in these digestive organs, we can do cupping here. Not for long time, but movement and cupping can be done in these areas to establish fresh humors and establish the equilibrium between the humors. Because if this area is fit, if this area is taken care of, we know in modern science we say that insulin imbalances are also taken care of, because the adiposity first is deposited here. So this is a very good space to do hijama to establish digestive wellness. Congestion, if we see any congestion in any of the organs, if we see congestion or toxins in maybe urinary system or in the visceral vessels, then this therapy can be done. And if there is coldness, especially in the area of kidneys, because kidney is a cold organ, and if the coldness is established, then hijama is a powerful tool to work on it. We can do from the front also, and we can do at the back of the body also. So both kidney points can be taken care of with hijama. But this is to mention that this is with the expertise of the practitioner, and also we have to see how many sessions are required. It is not magic. It takes time and it takes assessment. So we see that the kidney has to be, the Chi deficiency has to be established. So there can be other interventions also that a practitioner thinks of. Reproductive system, this is something, it's the talk of the era, because we have increasing PCODs, we have increasing infertility in people because of many reasons, because of lifestyle, because of stress. So this system can be very well established with vacuum therapies, with hijama therapy. Infertility caused due to blood stasis is what is the main focus here. If there is blood stasis in around the uterus, especially in case of people who are going for IVF, there are failed IVFs because the embryo is not implanted, because there is not frequent, not adequate blood supply, and the uterus bed is not ready. So before IVF, if sessions of hijama with other therapies is done, IVF has an increased rate of success in this. So blood stasis infertility is something that can be very well taken care of with hijama. Gynecological disorder, as I already explained before also, that dysmenorrhea, amenorrhea, due to blood stasis, due to coldness of the organs, or phlegmatic infiltration in the humors, then it can be assessed by the pulse, and then this therapy works very well. Cramping due to periods, or cramping due to any other reason, which is uterine cramp comes, and also postpartum cramping can be taken care of with this therapy, and it works really well, because here we have to choose which points we want to do. But right angle to the mid of the umbilicus, where it touches the right angle from the 11th floating rib. That is the point. If you see here, it said kidney and fertility. This point is the point of focus here for blood stasis and for cramping for both, and reproductive health. These points are the main point for hijama, and other than that, we go along. We put 3-4 cups around this area here and on the back also. So it is up to the discretion of the specialist what he wants to achieve. Bleeding, if there is excess bleeding or no bleeding, establishing a proper blood flow, reducing the coldness of the organ, that also can be established. And most frequently, migraines come due to hormonal imbalance, and they come either between the ovulatory phase of the periods or before periods. This migraine can be taken care of by hijama, and in ladies, it works well. Here, it will not be out of the point to mention that some people think that hijama should not be done with ladies because they already lose blood. Medically, we choose the ailment and do the treatment. And definitely, if there is periods are happening, if the menstrual flow is on, then the hijama is not done. But other than that, we can do in specific cases hijama on ladies also. Respiratory tract, this is something very sought after. Blood stasis in lungs, in local blood stasis, if you see the red areas here, this is the area where hijama is done for establishing proper breathing, establishing if there is too much phlegm inside, the cough is with mucus, there is stagnation of energy, there is pain while breathing, and the heat of the lungs, there is too much heat in the lungs, which is not dissipated, it's inside and it's inflammatory and it's drying the lungs, then this is the time where hijama works very well. These points are taken into consideration then, and also here the moving hijama cups also work well, and especially in this case, sooner or later the practitioner goes on to fire cupping also sometimes, because it is good to take care of blood stasis. Of course, first the heat of the lungs is treated without fire, and then it is a plan that is made. So it takes time, and it really works well on allergic stagnations also. For general wellness, what are the indications of hijama? If we have no ailments and we want to just do general wellness and detoxification and circulation in our organs, in our joints, then between the shoulder and neck, this is the area which you can see in this picture, between the shoulder blades on the root of the neck. It starts from here till the end of the shoulder blade. This is where the hijama is done. It takes care of the stiffness between the shoulder and the neck. It drains excess heat of the body. Here, top of this is also one point, which is point described for purification of body, which is called kahil avval. That point also comes in place, and hijama done on this place takes care of cold of the body, if there is cough with mucus, and if there is heat inside these joints, that is also taken care of, which leads to general wellness. So as we have discussed, various places where, various cases where hijama is implied, where hijama can be applied, and the practitioner can plan sessions to get the problem solved or get the disease cured, or at least the blood flow will be better. What is it that we can experience after hijama? So after hijama, it is felt that there is some lightheadedness. People may feel dizzy because the healing crisis comes in, because the blood flow is established. There will be circular patches on the skin. Even bruising can happen because autohemolysins are formed and the blood is moved up from the deeper organ to the skin. So the inflammatory process starts on the skin, and the white blood cells come in rush and start healing the cells of that area. So bruising can happen, and it can stay for 7 to 15 days. Scarring also may happen for sometimes, which mild, which in due course of time goes off. There can be mild discomfort of the area where the hijama is done, which is because the vacuum was created, so the skin was pulled in and it swelled, and the nerves were also involved. So it may cause mild discomfort. So what should we do? This is the important part after hijama. When the person is feeling little healing crisis, we have to see that where we should do hijama and where we should not do hijama. Where we should do hijama, I have already told, but people who have keloid scars, who have problem in healing scars, they make keloids, hijama should not be done with them. People who are in blood thinning medicines, warfarin, coumarin, ecosprin, or they have had congestive heart failures and they are on medicines, hijama shouldn't be done with them also. Anemic people should not be chosen for hijama. People who are weak in their humors. Hijama is, as I already said in the beginning, is the treatment for blood. So if the blood humor is weak, it shouldn't be done there, because first we have to strengthen the main humor, the cardinal humor of the hijama, which is blood. Blood has to be strengthened, and then we can do the hijama. And in case of people who have a symptom where they are on any chronic ailment, which is happening in all systems of the body, like cancers, hijama is point of discretion. It really depends on the specialist choice, whether he's comfortable enough to do it or not. So he can choose the point. And also the strength of the pulse, how much humor we can see. The volume of the humor is very important before doing Hijama. So we can see from here that assessment of the guest, assessment of the patient before starting any treatment of Hijama is important. So for that aftercare, once it is done, hydrate well, because your lymphatic needs extra fluids to drain off all the morbid material that was collected. Do not shower after cupping. Cupping should be done after shower, which means shower has to be taken 1 hour before cupping or hijama. So do not shower immediately after cupping. Keep the areas which were treated covered and warm. Do not go to very cold weathers, because it will start coldness of the organ, and the heat that we try to dissipate from the organ, that will be blocked. So it will cause another humoral imbalance. And you may feel fatigued. You may feel like you are feverish, you are tired. So do not feel that something is happening. It's the healing crisis. This is normal. Just you can go for a small walk. You can take a nice time out at the place, at the beach, or you can also work on relaxation lounges. So that is how you can take your time, and after 3-4 hours you will feel that it will start settling. What should we eat? What should we not eat? We can eat soft, light, warm foods after hijama. Meat should not be taken after hijama, because the body, it's too much for the body for to digest meat. So the fire will be diverted towards digestive system. So we don't want that to happen. So light meal is preferred. Meals rich in B complex, iron, and copper are advised, because these three help in formation of blood, and they add to the volume of the blood, and also they put the fatigue after the hijama to rest. So nuts, seeds, porridge, green vegetables, cooked vegetables, although raw vegetable is not very much prescribed. So cooked salad, soft potatoes, legumes, beans, dried fruits, they are recommended after hijama. So this is what all can help with the healing crisis. And with this, as I already said, this is a very ancient therapy, and in between 19th and 20th centuries, it was somewhat forgotten, but now we have revived it, and this is a great therapy to work on the body circulation, muscles relaxation, and without any intervention, we can start rejuvenation and improving our muscle strength and range of motions. So this is a very effective therapy, and in wellness field, I believe that it has a big scope, and it will be now onto the floor to create wellness amongst people, and people will be benefited from this by the practitioners, and we will be doing this therapy at Zulal also. So that will be all from my side. If you have any questions, please drop them as email. I will be more than happy to answer them. And thank you very much for joining my session. Have a good day.
Thank you very much, Dr. Purnima, for that interesting workshop. We hope you all enjoyed the session and have got some knowledge more about Hijama therapy, which is very interesting. Dr. Purnima, so now here are some questions from the chat. Okay,
yes,
this is very interesting question, and I am sure many people are quite curious. Is the therapy painful?
No. Mild discomfort, because the skin goes inside the cup because of the pressure, but it creates numbness, so you don't feel much of pain here.
Okay.
In hijama with pressure cupping.
Okay, thank you. Next question. Who is not suitable for hijama?
As I already said, people who are on blood thinning drugs, which are warfarin, coumarin, ecosprin, all these, and after congestive heart failure, people who are treated with stents, they have constant medicines. So blood thinning medicines are not, they shouldn't do the treatment. And also pregnancy, and people who have keloid scars in their body, they are more prone to warts and scars, they shouldn't do this therapy.
Thank you.
And with active menstrual flow also, yes.
Okay, thank you, Dr. Purnima. Next question. Are women allowed for hijama therapy?
Yes, for medical therapeutic purposes, yes, they are allowed, but they shouldn't be on their periods. They shouldn't be pregnant, and they shouldn't be trying for conception. So there we can do hijama, and there are specific points that's up to the practitioner's discretion. He can choose and he can work on it. Yes.
Thank you, Dr. Purnima, for your answer. Next question from the chat. Our guests need to know what the difference between hijama therapy and with TCM cupping using fire, because she see that it's quite similar.
Yes, it is almost similar. As I already said, that cupping, fire cupping is also described in Ibn Sina's book in Kanun fi al-Tib. So there is difference. The only difference is how we apply it, and also this is in case of heat, the morbid humors which are with heat. Fire cupping is will not solve the purpose. So we have to do something which dissipates the heat from the humors. That is the difference. So fire cupping is done to improve the chi flow in Chinese medicine. In hijama, we are talking about humors, and we are talking about dissipating the heat from the humors. So that's why this is the basic difference in the philosophy. So fire cupping can be done where we want to revive the organ and remove the chi. But in case of humors where we want to dissipate the heat, then it's dry cupping without heat.
Thank you, Dr. Purnima. Thank you for all your questions as well. Please accept our apologies again that because we are limited to an hour for this session, so we may not be able to answer all questions. But please leave your email address and we will send back our answer to you by email shortly. Thanks again for joining us for this session. So we hope you enjoy the session and learn some useful tips from today. Happy Global Wellness Day. Thank you very much.